And welcome to Coffee with Grant. We normally do these in the morning, Thomas. That's quite unusual. Eh? Obviously,
Correct.
we've been
Yeah.
very, very busy with our lives, and it's the weekend tomorrow, so let's
Yeah.
get on and enjoy it. So, what are we discussing today, Thomas? It's
Yeah.
diabetes, and you've got the correct term is what, Thomas?
Yeah. The correct term is diabetes mellitus, and that actually refers refers to the urine tasting sweet. Because if you've got high blood glucose levels, then the excess glucose is excreted through the kidneys and through the bladder. And that's where the name diabetes mellitus comes from.
Okay.
And I think most people know, first of all, that diabetes is extremely common. And there's a type 1 and a type 2. So we want to delve into those details, what their causes are, the symptoms, and how to deal with them separately. Right, diabetes mellitus, or the abbreviation, as you can see there, it's just DM. So there are two types that most people also know about. And the type 1 is often called the juvenile diabetes due to the frequency of childhood diagnosis. So very commonly, people are born with this type 1 diabetes, or it's diagnosed very early. However, one has discovered that this diabetes type 1 can affect anyone regardless of age, race, or weight. It's not specific to that. And why we classify it as a type 1 diabetes is because this disease prevents the body from producing insulin. Insulin is the hormone that is produced in the pancreas, and this hormone enables glucose to be absorbed out of the bloodstream and into the cells. So the glucose can't just enter the cells on its own. It does need this hormone called insulin to help the glucose entering cells where it is needed to do the normal functioning of every cell, whether it's a muscle cell or any cell of the body, any organ cell. So if you lack that insulin, then the blood cannot be entering the cells, and then there's no energy for the cells. At the same time, the glucose in the blood increases, and that can be very detrimental. Now, what causes the type 1? It's usually an autoimmune disease, and it's why it starts in some people and not in other people. That exact origin is not known. But autoimmune actually means that the body attacks its own cells, its own functioning. And that is self-destructive. Now, in this case, the body attacks the cells within the pancreas that actually produce the insulin. And these are islet cells, or islets of Langerhans cells in the pancreas. They are destroyed in this autoimmune disease where the body attacks those cells, and then it actually can't produce the insulin anymore. And if too many of these cells are destroyed, the body ceases to produce insulin, or enough insulin for the normal functioning of a body. Insulin lowers the amount of sugar in the bloodstream. As I said, it assists sugar to be drawn out of the bloodstream and to enter all body cells where it is needed for normal metabolism. And if this insulin is lacking, then the high sugar levels build up in the blood, and that can actually lead to life-threatening complications. So how do we treat or manage a type 1 diabetes mellitus? First of all, because insulin is no longer produced, such people do need to have insulin injections or tablets or patches. There are different forms of administering that insulin on a daily or regular basis to enable the person to live a normal life. Then obviously also in those cases, diet and nutrition are changed or adapted so that one takes in less sugar and rather other forms of energy that the body has to metabolize to stabilize the blood sugar levels on the long term. And exercise is always good for a healthy lifestyle. Now, on the other hand, type 2 diabetes is extremely common, also here in South Africa. It was known as an adult onset diabetes, but doctors are diagnosing more and more even children that have a type 2 diabetes. Now, this type 2 can have a slow or chronic onset, or it can happen pretty quickly, and a person will all of a sudden see the symptoms of diabetes with low energy, and we'll discuss some other symptoms just now. So what is the difference? In type 2 diabetes, the body resists the function of insulin. In other words, the body cells are not sensitive to insulin anymore. Or the body might stop producing enough insulin to have that effect of drawing blood out of the blood vessels into cells. Right. So type 1, just to summarize, there the cells in the pancreas are destroyed by your own white blood cells and your immune system, so that insulin can no longer be produced. In type 2 diabetes, very often there is enough insulin, but the body cells have become resistant to insulin, and there are various reasons for that. We also call it a lifestyle disease, the type 2 diabetes, and predisposing factors why many people suffer of it could be, for example, either one of the following. One is obesity, being overweight, then unhealthy eating habits. That would include diets with lots of refined starches, refined sugars, high sugar, high fat diets, very little fiber, and as I say, refined foods. And then the other one is modern sedentary lifestyle. That just means very little exercise, sitting all day or lying, and then the normal sugar metabolism within the body is not maintained, because a person burns very few calories but takes in a lot more calories than what they actually need for the body. And then there's also possibly a genetic background in some people, but some people are just inclined to easier get the type 2 diabetes than others. What are the signs or symptoms? And as I've said previously, this list is not all inclusive, but it includes most of the common symptoms that one can have as an indicator that you possibly suffer from diabetes type 2. And that would include fatigue, just feeling tired, weary, especially in the afternoons. There's just no energy to do the normal functionings. Increased need to urinate, that you just have to go more often. That will obviously also trigger higher thirst levels. You always need to drink more, and the more you drink, the more you urinate. It's like flushing your system. And increased susceptibility to yeast infections. That is also quite common. Often it could be diagnosed just as a yeast infection without people realizing the underlying cause, which could be a type 2 diabetes. Unfortunately, most people consider these symptoms part of everyday life. They just think, well, we're getting older, so one just has to live with it, drinking more water or doing this or that. But really, you don't have to live with it and battle with it. There are quite a few things that one can change in your lifestyle to cope with it and live a good life again. Complications of type 2, if it's not diagnosed and not treated correctly, the high blood sugar levels can damage the heart, kidneys, even the eyes, that you start becoming blind, and feet. The reduced blood flow to the legs, which is a consequence of sitting with a diabetes that is not treated. And this reduced blood flow may lead to gangrene. Gangrene is where parts of your toes or foot, whatever, just start dying off because there's no more blood flow. If there's no blood flow, then it doesn't bring oxygen, it doesn't bring nutrients to those parts of the body, and also metabolites can't be removed because of the decreased blood flow. Yeah, some people, even if they've suffered from this for a longish time, need to go to have parts of their limbs amputated because of the gangrene that has set in. And then we also find very commonly, if people battle with diabetes and it is not well managed, that they have wounds in those areas with low blood circulation. Infections can come into those wounds, and the healing just doesn't happen as quickly or properly as it should. We've had people telling us about battling with wounds for years, and those wounds just never get better unless they are treated. How do we manage this situation? Well, first of all, it's important that there's not one product that just fixes everything. As I said initially, type 2 diabetes is very much a lifestyle disease. So one has to adapt a few things to make it better, and also to empower the body to heal itself. First of all is on diet. It's very important to choose lower fat foods, to try and exclude refined carbohydrates and too much sugar, and to rather have a balanced meal, which would also include lots of fiber and fresh products, really farm fresh foods. Then exercise is important for every person, but in case of people that suffer from diabetes, even more important that they get into a habit of exercising daily. Maybe start slower, as much as your body can do, and then just keep on increasing it little by little, and that exercise will enable the whole body to recuperate better and handle the situation. Losing weight is always a good condition, and try to come to a weight that is appropriate for your height and for your age. And then avoiding being sedentary for long periods, especially people who have got office work, etc., that you take frequent breaks, get up, walk around a bit before you sit again, or maybe even have a desk where you can work while you're standing and not only be sitting all day long. That is just part of a healthy lifestyle and will also definitely make a difference in managing diabetes. Now, the Quantum.Silver for type 2 diabetes, recent studies have noticed that the nanosilver, which is the active ingredient of Quantum.Silver, that it exhibits anti-diabetic potential. How does it actually work within the body? And here we've just explained that the nanoparticles activate protein kinase C and P13K pathways as the insulin receptor. Now, what does all this mean? This actually means that the Quantum.Silver, if you drink it, it is circulated throughout your body through the bloodstream, and that makes cells again more susceptible to insulin. In other words, the problem with Quantum.Silver, the problem with diabetes type 2 is that the cells have become insensitive to insulin, and doesn't matter how much insulin you give to the body, it just doesn't seem to work. Whereas if a person starts drinking the Quantum.Silver, the cells start becoming sensitive again to insulin to do its normal work, and helping glucose to get out of the blood circulation and into the cells of the body. So the nanosilver, which is written here as Ag, which is the Latin for silver, and the NP is nanoparticles. The silver nanoparticles were effective in reducing insulin resistance. and also reducing DNA damage of cells in case of diabetes sufferers. So it's a very potent product to treat diabetes 2. How much to take? Our standard recommendation is to drink Quantum.Silver, 50 milliliter, 2 times daily for between 2 and 8 weeks. It depends how long you've been battling with this condition and how severe your diabetes is. If it's a relatively new case and you are pre-diabetic, then a minimum of 2 weeks might be even enough. But if a person has been suffering from diabetes type 2 for a long period, maybe even years, then a minimum of 8 weeks on Quantum.Silver twice daily will make a difference. Now remember, you always have the option. You can either buy it in bottles and drink the solution, 50 milliliters twice a day, or you can buy our Quantum.Silver capsules and drink 1 capsule in the morning and 1 capsule in the evening. If there are wounds involved, especially in the limbs where the blood circulation might be compromised, then we advise to also use either the spray or our Quantum.Silver gel directly on those wounds. And the more often you apply a new layer of gel or the spray, the quicker the reaction will be, so that the infection is taken care of and it helps the cells to regenerate and heal again. So in such a case, we advocate that you do both. You drink the product and also you treat the wounds. And that will speed up the recovery a lot if you do both. Then we also recommend, if you are on any tablets or treatment for diabetes, do not stop them immediately when you start with the Quantum.Silver. Carry on with them while you're on Quantum.Silver. There's no reaction between the two, and those two do not work against each other. But once you've been on the Quantum.Silver for 2 or 4 weeks, keep on monitoring your blood glucose, see what your energy levels are like. And then I've written there that we've had quite a few testimonies of people that have taken Quantum.Silver. These are now diabetes type 2 sufferers, and they could stop their medication after a few weeks of treatment with Quantum.Silver. And they never have to take their diabetes medication again. They're cured of that because the cells now have become sensitive again to the effect of insulin, and the body has been restored to normal functioning. Yeah, so just in summary, I think first of all, diabetes is very, very common here in South Africa and obviously across the globe. It will be on the increase because of the type of lifestyle that many people have, where we work more and more from home, at offices, sit all day, are less active, and then also with the refined foods that we have so readily available to us, which are actually not very good for a healthy lifestyle. So the good news is that we have got this product available to help people, especially those with wounds. And yeah, Grant, we've got fantastic testimonies of people that had wounds for years, even that had to go for amputations because the doctors had given up. There was nothing else they could do for the patient anymore. And then they heard about our Quantum.Silver and started drinking it immediately and also treating their wounds at the same time with the Quantum.Silver, and it healed. With it, doctors just shook their heads and said, wow, that is really like a miracle, because after so many years had given up, there's been hope, and the amputation didn't have to take place anymore. Yeah, so those are extreme cases, but I think there are many people that battle with it, that just battle with low energy. We have seen a constant flow of people that use Quantum.Silver for the first time. One of the common comments that they make is that they feel that they have more energy, especially in the afternoons and the evenings more than beforehand. And that is good to know. So that doesn't mean that they are pre-diabetic or they have a problem, but Quantum.Silver definitely has a positive effect on your energy levels and available energy to do work. Thank you.
Thomas, that was a very, very interesting subject. I mean, I've never had first-hand experience of it, but my sister has her middlest child, I think at the age of 5, has been on insulin for the whole of her life. And I spoke to her about this, and a lot of the questions she asked me, and I was going to ask you, you've answered. So it's very, very comprehensive. Because so what I'm going to do is get her to watch it, and it's a serious subject, but it's incredible that we've got these. And as you say, I have interviewed people who've been on the other side of it, and very, very chronic, almost amputation, right down to you haven't lost the leg, no skin grafts, back to normal. It's like that miracle scenario that you've actually got to see it, and some horrible pictures that go with it, which just makes it real. So for those of you watching it, just go into our YouTube channel, and all these examples are there, and all the other lectures that Thomas has done. So our website is on the screen now. It's www.q-health.co.za, and it's really, really informative. So Thomas, have you got anything to add before we knock off?
Yeah. No, I just would like to thank you for the opportunity. As I say, it is so common, and many people have given up and just accepted that they live like a second-class life, not having energy, not being able to do what they would like to do. But here's hope, and make use of the product and the lifestyle changes, and your whole life can turn around.
Very, very good. Thank you very much, Thomas, for joining me on Coffee with Grant once again.
Yeah, thank you. Have a great afternoon.
Cheers, Thomas.